tear service. So this point is, in fact, is the important point to treat for the most of the eye diseases normally, are the myopia, metropia, or the short sights or the long sights, so the vision disturbances are connected to the cataract as well. So certainly we can use the local point. This point is located on the muscles to be known as the orbicularis oculi. Orbicularis oculi, these muscles to be known as a orbicularis oculi muscles. So these muscles inside the point is located, but there are the specific nerve, so ophthalmic nerve. Then the muscles, especially on the oculomotor nerve, oculomotor muscles. So the muscles of the eyes get problem, or the thickness of the layer of the retina, thickness of the cornea. So we'll get deficiency or the excessiveness to be regulated, or the fluid secretion. Fluid is existing in the eyes. The fluid gets the dryness. That means how the mouth and tongue get dryness, lips get dryness. So likewise, chances are there eyes also get the dryness. So when the lubrication to be taken place precisely good, if that lubrication is dried up because the cornea thickness also more or less, or some dryness which is connected to vision, but certainly we can use this point to activate by using the ST1 to regulate the overall health for the lubrication of the eyes, to regulating the tears as well. But the tears is required. I don't get tears at all, so that also there is a problem. You will get oftenly get tears, that also some issues. But of course the tears will have some solution as well. Right? In that way, tears should come out naturally when the fluid secretion properly taken place. If it is more, when the tears also coming out, then that time we can use this point, and also other point, that point to be known as a UB1 Jing Ming. So point, both are good point to treat for the vision related problem. Both are vulnerable point, but alternative for that, you wanted to use something else is the point, the alternative point to be known as a C pi. C means is the 4, white, C pi means is the colors. There are the 4 colors point. So that point to be known as a 0.7 chun, 0.7 chun distal. 0.7 chun means this is 1 chun, but less than 1 chun. Less than 1 chun, just below, distal means below. To that stomach 1, that point to be known as a C pi, that is stomach 2. So the authors has written, Chinese people says that if you are phobia by inserting that needle, then the 1 chun deep needle can be inserted to the inside the eye. How many chun? 1 chun deep. Make sure that the proper technique is required. But now you wanted to use alternative for that, you can use the C by point, that point perpendicular or towards the eye you can use it, that also applicable. So therefore anything for the eye related problem, rather than stomach 1, better you can use the stomach 2 for the safer side. That would be really great point to treat for the most of the ophthalmic disorders as well. Now we ask them to give the pressure. So by giving the pressure on the bilaterally, both the sides, you are activating to the eye points, you are activating to the lower portion, you are activating to the Qingming, you are activating to the extra 3 Yu Yao, you are activating to the Shizukung, you are activating to the Tung Silio, you are activating the Chiosu. So this Chiosu is the extra point, gallbladder 1 point, Sanjo 23 point, extra point, and then is the Sansu UB 2 point, Qingming UB 1 point, and then the stomach 2 point, that is the C pi. When these points are all are connected to the macro meridian acupuncture points are existing, there you can use it, but micro meridians are called as a ocular meridians, or the eye meridians are there. So those meridians are very single shot. There are the points are located nearly vicinity of the eye. So around we can say around 10-15 points are this eye, 15 points are located on the other eye. You can activate all the points advisable, how the horizontal meridian, spiral meridian, vertical meridians are existing. Likewise, the eye meridian also, one of the meridian is existing. Those meridian you can activate by using this point. Or you are pinching. You are pinching to the Sansu. Sansu means UB2 point. Give the pressure. Give the pressure to the extra 3 point. Give the pressure to the Sanjo 23 and gallbladder 2 points. And pinch the point to this region, Sanjo 2. That means this stomach 2. All the points you are activating yourself to regulate. Yourself you can activate or ask the patient to activate themselves in order to promote the more energy to the eye system. Right. So hopefully we have the complementary to the Chengchi, that complementary point to be known as a which point? ST? To C pi. Very good. So now this is the second point. Now we'll come to the third point. So third point to be known as a Chu Leo. Chu Leo. So this point is exactly located. Do you know where is?
ST2 screen, sir. ST2 screen, 1 second.
Yes.
Thank you, sir.
This stomach 3 points is very closely located to the Yin Xiang. Yin Xiang is welcome the fragrance. Welcome the fragrance. That point is LI20. So LI20, close to that point to be known as a Chulio, that is stomach 3. Vertically below the pupil of the eye, vertically below the pupil, vertically means very straight, below to the pupil of the eye, and then lateral border of the Alanasi, lateral border of the Alanasi. So that particular point is stomach 3, where we inserted stomach 3 point is good point to treat for the nasal disorder and also stomach disorder. Do you know there is the large intestine belongs to which? Yang Ming nature, but stomach meridian is Yang Ming. So both are Yang Ming to Yang Ming. There is a connectivity that having the great job to treat for the numerous diseases related to the eye and the nose. That means sense organ related problem can be treatable by activating the stomach 3 point, and also swelling and pain, especially on the facial region, maxillary sinusitis, sphenoid sinusitis, ethmoid sinusitis, frontal sinusitis, right? All are cluster headache. Then the nasal problem, nasal polyps, nasal adenoids, all are can be treatable by using this particular point. Now the stomach 4 called as a Ti Kyang. Ti Kyang. The stomach 4 point is located. Where is located? You smile. Everybody smile? Yes. Once you smile, so during the smile, there is this nasolabial groove. This is the nasolabial groove. So where this groove on the outer side of the stomach meridian or outer side of the lips. So this lips muscles called as a orbicularis oris muscles. This orbicularis oculi muscles. This muscle's name is orbicularis oculis muscle. Ocular means eye, right? Orbit means this is orbicularis. Oris means is the kissing muscles. Oris muscles means ORIS. Oris muscles means this lip muscles. Lip muscles to be known as a kissing muscles. But this point is located on the orbicularis oris muscles. You smile it, you just look at the mirror, you smile it where the corner of the mouth. So generally you wanted to know point 4 chone lateral to the corner of the mouth to be known as a Ti Kyang. Stomach 4 point. What is the major physiology of this point? Many conditions we can use at this point, but certainly there is a deviation of the mouth, especially for the facial paralysis or the Bell's palsy. So that time, for example, the muscles, the masseter muscles has been upward direction. That time you just apply the needle in this direction. This should come out. This should come out like this, right? So in this way we can apply bilaterally. You wanted to use, you can use at this point. At the same time, the people who are using the pan parag or gutka or tobacco or I don't know, many things they use, even for the smoking addictions or the alcohol addiction. So for the mouth you wanted to use as a de-addiction point, certainly you can use the de-addiction point on the mouth, the local point. And also the people who don't want to open the mouth because they cannot open the full mouth because already they took the pan parag gutka for the last 20 years and now they cannot open the mouth at all. So that could be the reason we can activate this point, will be really helpful to regulate the buccal cavity, open the buccal cavity as well. If anything is the mouth ulcers are there or the lip ulcers, so even stomatitis, inflammation of the lips, so that time also you can use these local points. Local point is there, that local affected area you can aram say, you can apply the needle on that region. The patient says, I have the tooth pain. That means the upper tooth pain to be known as a chulio, lower tooth pain to be known as a chachi. Right, one is stomach 3 for the upper toothache and the lower toothache to be known as a stomach 6. Right, stomach 4, stomach 5 and then 6. But this stomach 4 point also you can use the local point. If the patient is complaining, I do have the pain on my teeth region or especially one tooth. So you just insert the needle on this region. Patient feel lot of relief by activating stomach 4 point as well. So stomach 5. Then especially stomach 4 also useful for the dribbling of the saliva, especially for the children or the convulsions, epilepsy. So the saliva is coming out through the mouth. So they are sleeping. So during the sleeping time the whole pillow get wet, right? Or even some adult, men and then women having that problem, they sleep like this in the night time, the drooping of the saliva. So that also can be treatable by using stomach 4 point along with the stomach 40 would be a better point to treat for the coming out the saliva through the mouth, especially in the night time or even in the daytime for the children who are suffering for the many related problems. Now the stomach 5. Stomach 5 where the point is located. So we have some muscles. These muscles called as a, yes, this zygomatic, good. But these muscles called as a, yes, buccinator muscle or the masseter muscles. Which is the strongest muscle in our body?
Vaccinated.
Is it so?
You told the other day, facial muscles.
Yes, very good. The masseter muscles are the strongest muscles in our body. Which is the muscles?
Which one, sir?
Masseter muscles. These muscles are the masseter muscles, are the strongest muscle in our body. These muscles called as a superficial muscles. Then the other deepest muscles to be known as a buccinator muscles. Right? So buccinator, B-U-C-C-I-N-A-T-O-R, buccinator muscle. Masseter muscles are M-A-S-S-E-T-O-R, masseter muscles. So masseter muscles are called as another muscle name is chewing muscles. Chewing muscles. When we chew the food with the support of which muscle? यही मसल्स हैं, masseter muscles. जब चबा के खा सकते हैं, चबा के अंदर ले सकते हैं. So crushing, right? So all, that's the reason it is the strongest muscles. Every tooth having the different functions, but for that supporting by the masseter muscles, right? Then the patient is complaining, I do have the pain on the lower tooth. That means canine and then premolar tooth pain is there. So that time you insert the needle on that particular region. The certainly patient will get lot of relief. There is no mechanical problem. There is no cavity. There is no some kind of the inflammation deep level. Then you have the very normal pain. That means mild to moderate pain of the tooth pain. Then patient feel lot of changes once you inserted the needle on this particular region. Or the patient is telling I have the pain here, but there is no acupuncture point. You wanted to insert on the specific region. There you can insert the needle. That's called as a sham acupuncture as well. That also having the positive effect on the that particular condition. Stomach 6 is the Chia Chi. So the stomach 6 point located on the highest point of the masseter muscles, highest standard of the masseter muscles. So this muscles is anterior part of the masseter muscle. You wanted to know where is the origin and where exactly the masseter muscles. You find out. Once again you can see where exactly the masseter muscles are existing. But when you clench the teeth, press to teeth, and then touch, touch the masseter muscles. Yes, anterior to the highest point of the masseter muscles, that muscles to be known as a stomach 6. That point to be known as a stomach 6. Clench karo, good. Clench karo, good. Stomach 6. Then stomach 7 is the Siakuan. Stomach 7 is the Siakuan. So vertically below the center of the zygomatic bone. Where is the zygomatic bone? This is the zygomatic bone. Touch and feel. This is the zygomatic bone. Just below to the zygomatic bone, above to this stomach 6. Below to the zygomatic bone. So this point to be known as a stomach 6 point. Stomach 7 point. Right? Stomach 7 is below the zygomatic bone. Above the zygomatic bone, there is a beautiful point, but I don't want to give you that information. But below the zygomatic bone, that stomach 7 point, Siakuan point is located. That point is really good point for the maxilla related disorders. Temporomandibular joint related disorders. Patient couldn't open the mouth, so there is the jaw got locked. So that time you can use this, open this jaw by activating this point. This indirectly helping for the two places, one place to be known as a ear, the other place to be known as a throat. That means is the aphasia, absence of the speaking, speech related conditions. We can use the Siakuan point, stomach 7 point is good point to treat for the speech related disorders as well. Then the most important point on the head region, perhaps we may ask you one question, which point is located on the head related to the stomach meridian? So then you can ask only one point is located, that point to be known as a stomach 8. Stomach 8 point. आपको पीना है. Stomach 8 point is toe wei. Toe means head. Wei means stomach. Toe tung. Toe means head. Tung means T-O-N-G. Tung means is the pain in Chinese terminology. To tung, to wei. To tung, to wei. To tung, to pain. Head pain is it. Then you apply the 1 point, that is to wei. That means stomach 8 point. Wei means stomach Toe means head. T-O-U. Toe. T-O-U. Toe. Yes, tung means is the pain. So where exactly the point is located? So do you know this crease to be known as a anterior hairline? This line to be known as a anterior hairline. From the anterior hairline, from the anterior hairline, from the anterior hairline, 0.5 chun above the anterior hairline, and then 4.5 chun lateral to the midline. This line to be known as a sagittal line. This line to be known as a mid-sagittal line. This entire line to be known as a sagittal line. These lines are there. This is the coronal suture. This is the coronal suture. This is the lambdoid suture. Right? So these lines are here, but that line to be known as a sagittal. But this line to be known as a anterior hairline. From here 4.5 chun. From here 4.5 chun. So where is the anterior hairline? Now for example, there is no hairs here, but we can place it from the glabella. This area to be known as a glabella. This is the glabella muscles or the mimetic muscles. So this region from the bridge bridge of the nose to the anterior hairline, how many chun? 3 chun. 4 fingers, 3 chun. Yes. Now you place your fingers. Yes. Once he places his finger, so this area to be known as a 3 chun. Now there is no hairs means you cannot go this, but here only this is as a 3 chun. Right. Now from here 4.5 chun lateral. You place your 4 fingers. Yes. Likewise you place 4 fingers plus 1.5 chun. Leave it. Plus 1.5 chun. Right. 1.5 chun. This is from here. Sometimes you may get some confusion where this point is located. Now from here, you locate from here also 3 chun. From here also 3 chun. From where is? This is supercilio-occipital line. Supercilio-occipital line. From here you just place the 4 fingers, then above the 4 fingers, because you measured here also 3 chun. You measure here also 3 chun, because here also anterior hairline is like this. 3 chun above from the eyebrow. So therefore from here also you select 3 chun, then the point to be known as a toe way is in that spot. Is somewhere you apply, for example, half chun superior to the anterior hairline I said, but the hairs are coming here, is the anterior region is more. The more hairs are here, but you cannot take it this entirely to this region. So hopefully you understand from here to here is how many chun? 3 chun above, 3 chun above, 4.5 chun. So 3 chun above from this region. That means indicating toe way. So how many of them understand these 8 points? Tell me. Chengachi si pai chulio ti kyang te ing chia chi sia kwan toe way. These are the how many points? 8 points. 8 points in your packet. But how many of them knows this? I'm not very sure, but still you keep it in your mind. All the 8 points are located. Where is the location? Now I'll come up the summary. Eye point. Eye diseases can be treatable by using the single point. What is that point? Stomach 2. Very good. Stomach 2. For you all, right? Stomach 2. Keep it in the mind. Eye diseases can be treatable by using the point to be known as a which point? Stomach 2. Then the nasal problem can be treatable by activating the single point. That point to be known as a stomach 3. Right. Now the lips related problem and the mouth related problem can be treatable by using the Stomach 4 points. Right. When there is the mastication and cannot open the mouth, so that condition can be treatable by using the single point. That point is stomach 5. Then the upper tooth pain. Upper tooth pain can be treatable.
Stomach 6.
Upper tooth pain. Upper, yes, stomach 3. Then the lower tooth pain can be treatable.
Stomach 6.
Stomach 5.
5, 4.
5 and 6 as well. 5 and 6. Right. Then the speech related problem can be treatable. Stomach 7. Good. Then the head related problem. Stomach 8. Yes, this is in fact we left around 2 points only, remaining all the points are we can use it, which is the very safe treatment can be given. Today the biggest pain, the largest pain, the maximum people will be suffering some kind of the pain, that pain to be known as a tooth pain, right? Tooth pain is today is the great pain. The most of the people are suffering for the painkillers they are using or anything connected to the pain, the tooth pain. That's the reason there is the dental dentistry has been made, that is the 5.5 years course, right, to eradicate this kind of the pain. But tooth is very important, the teeth is very important. So always you register in your mind, clean your oral cavity, keep hygienic your oral cavity, always is good. If you wanted to keep it, the teeth will be good condition. If you don't keep it, that means after eating you are started functioning, you are started working, then certainly which causes the much more problems. Then later at the age of 40 years, we know that after the 40 years, the tooth will become decay or some kind of the weakness, the falling will start it. So that's the reason, be careful and protect your teeth precisely good. So hopefully we completed around 8 points.